Hello, I'm Jeremy Fernandez. Tonight on The Virus, a fatal mystery infection, plus the great Australian sporting tradition. Can community clubs survive this COVID-19 shutdown? But first, the country's top contact tracing teams are desperately trying to find out how a 30-year-old Queenslander died from the virus. Nathan Turner had a complicated medical history but hadn't travelled overseas or even left his community in months. So far, his contacts and friends have all tested negative. Hundreds of people are now being tested in and around Blackwater to see if the cause of the infection can be identified. At 30, Mr Turner is Australia's youngest COVID-19 victim.
A bit surprised, actually. We thought it might have come in with one of the fly-in, fly-out workers.
Queensland was coming good. Then all of a sudden, out of the blue, something like this happens, and it gives you a big wake-up call.
Meanwhile, a new cluster in Western Australia is also keeping health authorities there busy. The live animal export ship, the Al Kuwait, docked at Fremantle Port a week ago. 12 crew members have tested positive so far. The Premier, Mark McGowan, initially claimed his government wasn't told of illness among the crew, prompting the Federal Agriculture Department to release emails contradicting Mr McGowan. He's since acknowledged that the information was there, but maintains there needs to be better communication at senior levels of government.
This morning I contacted Minister Littleproud to discuss the issue and the need to improve communications between all parties. There have clearly been some errors made all round. We can and must do better, and we will.
Meanwhile, health officials in South Australia were forced to admit they were given the travel details of a British resident who later tested positive at Adelaide Airport. Initially, they claimed their Victorian counterparts didn't inform them the traveller was flying into Adelaide. The 50-year-old came to Australia to visit a dying relative and was granted an exemption from quarantine on compassionate grounds. So South Australia is now reviewing the exemption process. Well, it was the day many kids in New South Wales and their parents were looking forward to, the return to school. But within hours, 2 private schools in Sydney's east were shut down because of coronavirus. One student at Waverley College and another at nearby Maria College tested positive, prompting an earlier than expected pick-up time for parents. There have been no other reported cases at the schools, but the incident has highlighted the need for vigilance.
We're much better equipped than we were at the end of term 1, and I think that, keeping schools open is important. The health advice has always remained that that is something that we should be doing, and I'm confident that we can keep on this path.
Well, despite those few minor outbreaks in some states, the numbers this week have been positive. Just 4 new cases were confirmed on Monday and just 6 on Wednesday. The federal government has put industrial relations reform at the front and centre of its plan to revive the economy from its coronavirus hibernation. The Prime Minister wants union and business leaders to forge a new accord on wages, and it started the process by throwing out the government's so-called union busting bill. A makeover of the trade and training system is also being touted. TAFEs are set to be revitalised with a focus on advanced manufacturing. Experts say it's crucial that the government moves away from the private training company model.
Silly policy of letting private sector for-profit providers into education, which didn't work, and then you had a focus on universities at the expense of vocational education and training.
Almost 1.5 million people have taken up the option of dipping into their super to help them survive the coronavirus shutdown. All up, more than $11 billion has been withdrawn, but financial advisors warn it will cost those withdrawing dearly down the track.
The government scheme allows people to withdraw up to $10,000 this financial year and another $10,000 between July and September. So far, 1.3 million people have taken up the offer. More than a third are under the age of 30. The largest group to access the scheme were those aged between 26 and 30. The average amount they were allowed to withdraw was just over $7,000. Financial advisors warn accessing super should be a last resort.
If you're in your 20s, the access to money in retirement age 67 seems more than a lifetime away, and they would be thinking about their circumstances now.
So what will it mean when retirement does finally come around? A 20-year-old who accesses the full $20,000 on offer could lose $95,000 from their retirement balance. A 30-year-old stands to lose about $80,000, and a 40-year-old would see their retirement nest egg shrink by more than $50,000.
Australia is now part of the race for a coronavirus vaccine, playing a major role in the first Southern Hemisphere trial involving humans. The vaccine candidate has been developed by an American pharmaceutical company, which says its trial on baboons has been very successful. 131 people in Brisbane and Melbourne will now be assessed over the next month to test the vaccine's safety and efficacy, and ultimately whether it can protect people against COVID-19. The accelerated first phase of the trial will be completed in July before the developers get ready for more advanced testing.
Just really looking forward to getting started, because this is obviously a really big step in the right direction for the entire world, basically.
The developers of the vaccine say if everything goes to plan, 100 million doses could be made available by the end of this year. Another significant milestone in the loosening of restrictions has been reached, with professional contact sport returning to our screens. Athletes have undergone a strict testing regime, but some experts maintain that the resumption of major football codes sends the wrong message. The major concern for sporting organisations, however, is grassroots community clubs. Most of them run on very tight budgets and rely on a mostly volunteer workforce. The shutdown has left many organisations weighing up their future.
For a lot of grassroots, clubs, it is a massive financial sting.
We had no other choice but to suspend our activities. Our families are going to be hurting through this. So how do we deal with the situation where some families aren't going to be able to pay the fees that we normally have to play games?
And we put some of your questions about the future of community clubs and local gyms to ABC Sport broadcasters Tracey, Holmes and Paul Kennedy, as well as Matty Clements from the Australian Institute of Sport. I cannot tell you how many questions we're getting in right now as we speak and throughout the course of the last few weeks, drawing this comparison, particularly recently, between pubs and clubs and restaurants reopening, but gyms not reopening, swimming pools not reopening, general, kind of dance classes not reopening. Tracey, how do you explain this from a health communication point of view to the community?
I wish I could, because I've been asking the same question for a very long time. And I think a lot of questions way back at the beginning as well, because there was some discussion about whether COVID-19 could exist in salt water or chlorinated water, and therefore should swimming pools be open, and would it be actually a good place to go and get your regular physical exercise? There hasn't been a lot on that, and I think partly that's because this whole COVID-19 disease is so new and there's still so much they don't know about. We're hearing, new things that are being discovered every day, but we're also seeing how that morphs and how it's reacting in different societies every day. We're very, very lucky here in Australia because I think, you only have to look around what's happened in the rest of the planet. We're in a very good position, so you don't want to undo all of that good by suddenly rushing back and saying there's no problem, it's okay. But I think it's a really valid question. It's one that a lot of people have been asking, and we have put it to various health officials, and the same story comes back. It's just that it's a very early thing.
Matty, that companionship is critical, just like the exercise is, to what a lot of people are asking about this link between physical exercise, being outdoors, and mental health. You're a psychologist. You must relate to that question on so many levels.
Absolutely, and even at the elite level of sport, that social interaction is a really important factor for people partaking in elite sport, but also wanting to get back into it. And it is very much, it has been about just managing expectations of the athletes. So we've got the different restrictions being lifted, but making sure we do it sensibly, because everyone does want to spend a bit of time with one another. It is different to Skype. Being around people, training with people every day, it's a really important part of these athletes' lives, yeah.
Maddie, professional athletes are among the first being, sort of at the forefront of these restrictions being lifted. How are they feeling about going back to sport and to that sort of close contact sort of environment?
Yeah, to be frank, a bit of a mixed bag. There's obviously many that are absolutely, really excited about getting back out there, doing the thing they love, etc. But not surprisingly, there's some that have a little bit of concern about returning into that. As Tracey mentioned earlier, there is so much we don't know about this virus, so it would be natural for people to be a little bit worried, anxious and stressed about re-entering into those various environments.
And we've got this question from viewers saying, how am I supposed to get my active children to physically distance when contact sports are resuming? There's that sort of, sort of disjuncture, isn't there, between what we're told to do as non-professional athletes versus high-performance athletes and what we're seeing, on TV and in the news.
Yeah, this is something that I've spoken a lot about for many years, and that is we put it all into the same basket. And I think we forget sometimes that what we're talking about at that very elite end of the major professional sports, because we've got the elite end in Olympic sports where a lot of people there don't make very much money at all and they need to supplement what they earn, the small amount of earnings, by doing other things. But when you're talking about the major football codes, potentially basketball, a couple of others fit into that, cricket as well, you are actually talking about a multi-billion-dollar business here, and it's a little bit separate. And I think this comes back to some of those arguments we have all the time about what is a role model, what isn't a role model. So at that very elite end and the professional end, these people are doing a job, and as a flow-on from that economy of professional sport, there's a lot of other people whose jobs and careers rely on them coming back. So it's almost like it's a different thing. And I think as parents, or as teachers or community leaders, we need to be able to explain that difference sufficiently to kids. And I know kids are being taught this in the playground, how to play games and have fun, but still maintain all the things we've been taught to do. Wash your hands, keep that distance, try not to touch each other. So it's just about explaining that level. And if we're looking for things that we should be doing, it's what our teachers and our parents are telling us in our playgrounds and schools, or community-based sport, which are making adaptations as they begin to come back. And the professional sport is something else, and hopefully one day they can get to that.
We've got the people who do ballet, the people who swim, the people who do martial arts, figure skating, ice hockey, saying, what about me? When do I get to go back? And the answer, of course, is we kind of don't really know yet.
Yeah, we don't really know. What you really need to do is get in touch with your local club or local organiser or state body of the sport that you are part of. And I think in all of this, and it comes very much back to the Return to Sport toolkit, if you have a look at that, it just offers really good advice because it suggests ways of, we're all keen to get back and do these things, but we're also concerned about what we're going to meet when we get there. And it's about not just thinking about ourselves, but the other people that are involved as well. And remembering that most sports are run by volunteers. We're talking about hundreds of thousands of Australians who volunteer their time, a lot of grandparents who volunteer their time. Not all of them will be in a hurry to come back. And so not all of the facilities or all of the competitions that we're used to will come back in the same way. Some clubs, unfortunately, and some teams may fold. But the next body up, whether it's your local club or your local association or the state body, will be able to direct you to what is happening when and help you get in touch with like-minded people who are all thinking about themselves and each other to make this a nice transition, a transition that is going to be healthy and suitable for everybody.
PK, as Tracey just noted, and a lot of our viewers are noting as well, there are a lot of groups, businesses that are simply not going to be able to sustain this downturn. Do you see that wave coming, and when will that reach a critical point?
Well, I think we're all going to be seeing that pressure mount in September, perhaps, when the end of the government payments stop and when things change that way. So I think, there will be pressure on local businesses that get around sport. I think, but Tracey makes a great point about pressure on the individuals, and you've got to look after yourselves. You really do. We've got a president at one of our local clubs who's runs a local business. He's had to put off 6 or 7 people. He's under as much stress in his work life as he will ever be. Running a club as well and going to meetings with the league and you know, at some point, as I said to him, you've got to just say, what are we working towards here? Yes, we want to get back and we give the kids somewhere to play and we want to have a competition, but at what point do you say to yourself, well, let's take the stress out of it. Maybe we just train and have some practice matches at some stage. Do we really need a full competition? And that's what some clubs and associations are doing. They're saying it's too hard. Let's not do it this year. And I think that's a very reasonable decision.
Final question from one of our viewers about what the future looks like, Tracey. You know, we can take care of our diet, we can try to exercise in these times, but once this is all over, this viewer suggests another one of those fitness be in it campaigns, you know, to get people up and moving again. Do you think that would work, and what would that look like?
I actually laughed when I read that question, only because I put that very question to Rob Dalton, who's the acting CEO of Sport Australia at the moment, and we were talking about the toolkit, you know, because there's a lot of people that are thinking, oh, I'm a grandparent, I can't go back. That's not true. Actually, you can if you're involved as a volunteer in community sport. But one of the things I put to him was, I can see this happening. We've become so used to now, the past 2 months, of being locked in a small space and sitting on our chairs and lots of kids doing this. Yeah, exactly. And that I remember that campaign, Life Be It at Norm, getting off his chair. You do not. You're way too young, Jeremy. But yeah, you know, it probably is going to take something like that, and that's not a bad thing.
PK, I have to say, when I read that question, it sort of made me hopeful for the future about this, you know, sort of new wave of people being encouraged to get out and where being sedentary isn't such a virtue as it is right now.
Yeah, well, go to your local bike shop and try and buy a bike. You won't be able to get one because they're out of stock. People have been rushing out, buying bikes. In the suburb I live in, people have been walking. It's been good for some parents, dads and mums, who spend a lot of time in their car and commuting. They had work from home. They're connecting with their kids in a way that they haven't been able to before. I'm really lucky in a family setup like this, and with lots of friends locally, and we are, you know, we're itching to go and get back in sport and do all those things. I think the big change is that I'll be more selective about that. In a way, I was running the kids around every night of the week, and to hit that pause button has been really helpful for me, and others have said the same. They're going to just pick and choose what we're going to do now. We're going to slow down a little bit, but we're going to really enjoy the time we spend together, and yeah, we're going to get active. I think it's going to be, I think it's a wonderful reset.
First a city, then a country, then the world. With reports of deaths on most continents and no vaccine in sight, the questions remain. How far will the virus spread? How many lives will it take?
Now, globally, the number of known infections is climbing towards 6 million. The US, Russia and Brazil still have high infection rates. Revised figures from Moscow show twice the number of people died in the month of April than originally declared. Overall, more than 360,000 people have died around the world. And as we just saw, the United States has become the first country to lose more than 100,000 people to COVID-19. Most of those have been in the main population centres. More than 29,000 have died in the worst-hit city, New York, and Los Angeles, Detroit and Chicago have also been badly affected.
The president's in dire need of some good news, having overseen a catastrophic response to the coronavirus pandemic.
It's going to disappear. One day it's like a miracle, it will disappear.
That was late February. A national emergency was declared in mid-March. By April 12, America topped the world's death toll. Now more than twice as many have died here than the second hardest hit country, the UK.
He failed to act, and the virus got out of control.
The president's political opponents are now trying to paint him as an incompetent who prefers golf over leadership.
Thanks for joining us. If you want to see more of that Q&A session with the ABC's Tracey, Holmes and Paul Kennedy and Maddie Clements from the Australian Institute of Sport, just go to the ABC News YouTube and Facebook channels. For now, though, stay safe. Thanks for your company. Goodbye.